Hello, this is Dr. Robert Bouvier with Dr. and you were sent here to learn a little bit more about the kit. And so what is the kit? The kit is a personalized, customized medication and medical kit that takes care of what-ifs and emergencies that happen when you're home, when you're abroad, when you're traveling, when you're local, just that the patient takes with them, that is personalized to their specific diagnoses and their needs and maybe their family's needs for the what-ifs that happen in life. They come in various forms. This is a travel one. It zippers up, packs down pretty well. This is one of the larger ones. There's probably 15 different medications in here, a blood pressure cuff, bandages, as well as medications that they might use, and we're going to go into that a little bit more. This is a little bit larger one that somebody might use in their home. It has a ear speculum and a blood pressure cuff. It has a little temperature thing, checking for people's temperature. It's got places for medications, and actually this one is specifically for IVs and other things, and not necessarily for the patient to use, but certainly for a home health care agency or a paramedic or somebody that's doing a home visit could utilize, since they don't carry the medications themselves. And this is a place for just a plastic container for medications. So what is the book for, or what is the kit for? The kit is for those what-ifs that happen. You know, these are different things can happen at home. I'll give you an example. During this time of year, it's the flu. I give Tamiflu out like it's candy around here, not to take right then, but to take just in case they come up with the sore throat, the high temperature, that shaking chill. They're supposed to take Tamiflu within, what, 12 hours? Or it's ineffective after that? Well, who's going to get a hold of their physician, actually go to the pharmacy, pick it up? If you have it ready, then you're ready to fight the flu right away. You can cut those flu symptoms by half. Many times it totally eliminates the flu altogether if you catch it quick enough. That's the whole point. I'll give you an example. I had a patient traveling in Singapore. They themselves had a problem with irregular heartbeat, the so-called atrial fibrillation. They were traveling with a person 4 hours from Singapore. This other person, it wasn't my patient, but it was this other person, came down with this terrific heart rate, was racing. Chest pain, there was just like it was coming out of their chest. Well, my patient knew what was going on. There's irregular heartbeat. He got into his kit, very similar to this, pulled out an iPhone that had an EKG, checked the EKG. The person was in atrial fibrillation with a heart rate of nearly 140. They got me on Skype. I was in Michigan at the time, and they were in Singapore. They got me on Skype. We got into their kit. We gave them some antiarrhythmic medication. They were able to send the EKG to me over Skype. They were on their way to Singapore, to a Singapore hospital. I faxed the information to the Singapore hospital. By the time they got there, the irregular heartbeat had improved. We give a couple other medications from the kit. There was no health care available to this person. You know, they were out of Singapore, and by the time they got to Singapore, heart rate was down to 95, still in atrial fibrillation, but the patient was feeling much better. We were able to do an additional EKG on the patient. I had faxed that again to the Singapore hospital, and the Singapore doctor called me back and said, you know, you have to tell me more about this kit that my patient had. So it helps not just the people around them. Other uses would be for nausea and vomiting, traveler's diarrhea, pain pills, anxiety, sleeping, all sorts of reasons to have the patients have this medical kit, or what we affectionately call the kit. Who has it? Patients. You know, patient's family. Many times we have medications in there that the patient has no clue on what to take or how to take it, but the medical professionals that they're with, or that we can get on Skype, can direct them to the kit and actually take things out of the kit, and we can utilize that if the patient has it on them. And we personalize this, customize it for each individual patient and their medical needs. Why? I think you kind of get the gist of why we're doing this. We know what it is. You know, the where and when is whenever they need it. The reason we have other medications in there, and even some injectables with some people. Not that the patient is going to use that, but many healthcare providers, especially home healthcare nurses and paramedics, don't carry that stuff with them. But if somebody needs extra Lasix, who goes into congestive heart failure, needs a medication that we put in there, an antiarrhythmic or whatever, they have it in that patient's kit. The nurse or medical trained personnel can actually utilize that and actually keep them out of the hospital and keep them out of harm's way. And we use that kit in conjunction with this whole concept of transitional care management. It's one of the tools that we use quite heavily. So how did this all evolve? How did this happen? Well, actually I was touring and giving lectures in Canada, and I noticed that there was quite a few home health care nurses coming to my lectures, and they talked about this medication kit that nearly every patient that was discharged from the hospital, every one of their home health care patients had this thing called a kit. It's like all across Canada. It was great. And so I said, we should utilize that here in this country. So I'm on a quest for all discharge patients across the United States to have this medication, personalized, customized medication and medical kit available, especially for those transitional care management patients. Hospital administrator, discharge planner, home health care nurse, paramedic. Listen to what I'm saying here. Use this kit. It will help people stay out of the hospital. And you know what I mean in that readmit rate that's plaguing some of you guys. So again, this is Dr. Robert Bouvier. We've been speaking about the kit. And if you have any questions, please get a hold of us. You know the number, 810-694-7412, 810-694-7412, or just email me. Robert@robertbouvier.com. That's Robert@robertbouvier.com. Or you can go to the website, Dr. and You, and learn a bit more and contact us through the website. Again, this is Dr. Robert Bouvier with Dr. and You. We've been talking about the kit. Have a great day.